Put your trust in us and we'll be champions.
When I was a kid, the disaster we worried about most was a nuclear war. That's why we had a barrel like this down in our basement, filled with cans of food and water. When the nuclear attack came, we were supposed to go downstairs, hunker down, and eat out of that barrel. Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. Kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence.
I am asking Congress to end the dangerous defense sequester and fully fund our great military. And we will soon have far and away the strongest military that we've ever had. And hopefully, you know what? It'll be so strong and so powerful that we won't have to use it, okay?
But we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic.
Words about a pandemic at this point?
No, we're not at all, and we have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine.
Now has more reported cases of the coronavirus than any other country in the world. Think about that for just a second. There are more than 85,000 across all.
The richest country in the Western world in 2020.
The strongest economy in the world.
This is actual real life in the hospital now. They give you a paper bag.
Paper bag where I store a face shield and an N95 mask.
And I have to bring it to and from work every day. Do you think that that sounds safe?
Clean it between patients, use it until it breaks. Unacceptable.
Especially because I am 16 weeks pregnant.
We're delivering millions and millions of different products, and all we do is hear that, can you get some more?
To say that we are not using our masks correctly or that we're hoarding them.
I don't think it's hoarding. I think it's maybe worse than hoarding.
That's completely preposterous.
What we're seeing hospital workers do is actually going out and finding protective equipment in whatever possible way we can.
Where are the masks going? Are they going out the back door?
I have been wearing this surgical mask for 2 days.
I'm on the third day of using my N95.
They've been delivering for years 10 to 20,000 masks, okay.
How do we go from 10,000 masks
to 300,000?
I'll tell you how as a healthcare worker. Because we have a pandemic.
America is not prepared. And nurses are not being protected.
Donald Trump still doesn't have a very good answer to a very important question. Why didn't he do more to warn Americans about coronavirus as it spread in February? Donald Trump has sought to avoid accountability for what's been called a lost month or a lost two by deflecting blame and blaming others. One of his targets, the World Health Organization. He insists that they, not he, mismanaged the early stages of the crisis. But a brand new blockbuster piece of investigative reporting from the Washington Post undercuts one of Donald Trump's central defenses. The Post writes this, quote, more than a dozen U.S. researchers, physicians, and public health experts, many of them from the CDC, were working full-time at the Geneva headquarters of the World Health Organization as the novel coronavirus emerged late last year. and they transmitted real-time information about its discovery and spread in China to the Trump administration. That's according to U.S. officials and international officials. The presence of so many U.S. officials undercuts Trump's assertion that the World Health Organization's failure to communicate the extent of the threat is born of a desire to protect China that is largely responsible for the rapid spread of the virus in the U.S. The administration calls this report by the Post misleading and emphasizes that those staffers weren't decision makers.
The problem wasn't that there was a system that didn't work well enough. The problem was that we didn't have a system at all. And a large epidemic would require us to have hundreds of thousands of workers.
This airport has received over 1,000 medical support charter flights and cargo flights since January 24th. A massive influx of medical staff and supplies has been pouring in Wuhan, the hardest hit city. East China's Jiangxi province sent more than 300 medical teams consisting of some 40,000 medical personnel have been dispatched to Hubei from across China. Ensuring the provision of medical supplies in Wuhan and Hubei is prioritized. 19 provinces have paired with other cities in Hubei to provide one-on-one support. This is one of Wuhan's biggest temporary hospitals, accommodating some 3,500 beds for infected patients with mild symptoms. It took only 19 hours to pull all forces together to begin construction. In a short period of time, Wuhan builds two major makeshift hospitals, Hushenchan and Weishenchan, and converts many gyms, conference and exhibition centers into temporary hospitals.
So there was a lot that was missing, and these things are really a global failure. The WHO is funded to monitor epidemics, but not to do these things I talked about. Now in the movies, it's quite different. There's a group of handsome epidemiologists ready to go. They move in, they save the day, but that's just pure Hollywood. The failure to prepare could allow the next epidemic to be dramatically more devastating than Ebola.
Hell. Biblical. I kid you not. People come in, they get intubated, they die, the cycle repeats.
You overwhelmed?
Yeah, the system's overwhelmed all over the place.
Stop, literally, and unfortunately it might get to a situation you have to pick and choose what you're gonna do, how you're gonna do. And as the doctor said, a lot of people come, they not really survive, they expire, and you put the same machine on another person, and you cannot really even cope with the situation because it's so hard to think about this. And we try to do our best. The only thing I ask everyone, I know you guys from England, we live in the States, stay at home if you don't need to go anywhere. Don't try to do anything crazy right now. It's a serious pandemic.
Let's look at the progression of Ebola over this year. About 10,000 people died, and nearly all were in the 3 West African countries. There's 3 reasons why it didn't spread more. The first is there was a lot of heroic work by the health workers. They found the people and they prevented more infections. The second is the nature of the virus. Ebola does not spread through the air. And by the time you're contagious, most people are so sick that they're bedridden. Third, it didn't get into many urban areas, and that was just luck. If it had gotten into a lot more urban areas, the case numbers would have been much larger. So next time we might not be so lucky. You can have a virus where people feel well enough while they're infectious that they get on a plane or they go to a market. But we need to get going because time is not on our side. In fact, if there's one positive thing that can come out of the Ebola epidemic, it's that it can serve as an early warning, a wake-up call to get ready. If we start now, we can be ready for the next epidemic. Thank you.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus. The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries.
We have very little problem in this country at this moment, 5, and those people are all recuperating successfully. But we're working very closely with China and other countries, and we think it's going to have a very good ending for us. So that I can assure you.
The detection of this small number of cases could be the spark that becomes a bigger fire.
The virus. They're working hard. Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
If we don't use the window of opportunity we have now, if we don't operate with a sense of urgency, there could be a serious consequence. It's not either or. We must focus on containment while doing everything we can to prepare for a potential pandemic. Every country needs to be ready to detect cases early, to isolate patients, trace contacts, provide quality clinical care. We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
President Trump now tells us China is to blame for the havoc that the coronavirus is wreaking across the world. He's paused funding to the World Health Organization because he says it colluded with China in keeping the facts hidden. To evaluate these claims, just keep in mind one tweet from the president on January 24th. China has been working very hard to contain the coronavirus. The United States greatly appreciates their efforts and transparency. It will all work out well. In particular, on behalf of the American people, I want to thank President Xi. What did the world, including President Trump, know about the virus at that point? Well, one day earlier, on January 23rd, the World Health Organization warned all countries should be prepared for containment of the virus, including active surveillance, early detection, isolation, and case management, contact tracing and prevention of onward spread, unquote. By this point, stories about the virus were all over the news. China had announced that the virus was being transmitted between humans and had begun locking down parts of Hubei province. As for the US government, on January 18th, a week earlier, Health and Human Services Secretary Alex Azar had briefed Trump on the dangers of the virus, according to the Washington Post. By January 24th, there were 2 confirmed cases of the disease in the US, and on January 27th, the Centers for Disease Control issued a level 3 warning to avoid non-essential travel to China. On January 29th, Trump tweeted, "Just received a briefing on the coronavirus in China from all our great agencies who are also working closely with China." That very day, one of Trump's most trusted aides, Peter Navarro, wrote a memo warning about a possible pandemic that could kill up to 500,000 Americans. Navarro noted that Chinese reports indicated that the virus was likely far more contagious than the flu, more like the bubonic plague or smallpox. The next day, January 30th, the WHO declared a global public health emergency. Just hours after that, this is what Trump said.
We're working very strongly with China on the coronavirus. We think it's going to have a very good ending for us.
So the question is, was Donald Trump telling the truth about China then, or is he telling the truth about it now?
Something could have been contained at the original location, and I think it could have been contained relatively easily. China is a very sophisticated country, and they could have contained it. They were either unable to or they chose not to, and the world has suffered greatly.
Let's jump straight into the first question that everybody would want me to ask. You delivered a TED Talk where you predicted pretty much what is happening now. Now, thanks to the world we live in, that has sprouted a bunch of conspiracy theories, everything from Bill Gates invented this virus to prove himself right, or he knew it was going to happen and that's why he said it. Was that TED Talk about this virus, or was that a hypothetical that has now come true?
Well, I didn't know specifically that it'd be coronavirus and that it would hit in late 2019. But the goal of the talk was to encourage governments to make the investments so we could respond very quickly and keep the case numbers very, very low. And so sadly, this is not a case where, I feel like, hey, I told you so. Because we didn't use that time when it was clear as the biggest threat to kill millions of people, to have the diagnostic standing by, to be ready to ramp up a vaccine factory. A few things were done. Some countries, our foundation funded some work that will help with the vaccines now, will help with the diagnostics, but most of what was called for, particularly in a New England Journal of Medicine article I did that went into way more specifics than I could in a short TED Talk, those things didn't get done, and so that's why it's taking us a long time to get our act together faced with this threat.